Welcome to the Dr. Loria Medical Podcast. I'm incredibly excited, and I'm sitting here with Dr. Loria. And Dr. Loria, you're considered the most experienced male enhancement doctor using permanent filler, correct?
That's right. That's right.
Well, I know what that means, but for our listeners out there, can you break that down as to what you help people do?
Well, what we do is we do male enhancement, meaning that we enlarge the penile shaft and glands and scrotum. It's how we do it that's very unique. For example, there are many methods of enlarging the penile shaft. A lot of patients know when they search out for male enhancement, they'll see fat transfers and grafting and all these types of things. Now, what we offer is something unique, that it's a permanent filler injection, where when we inject the permanent filler into the penile shaft, glands, or scrotum, there's a reaction that occurs that builds up collagen, which is your own natural tissue, which is a wonderful thing because it feels natural, because it feels like your own skin. So we use permanent filler to enlarge those three parts of the male genitalia. It's permanent, lifelong, and so forth. And another good thing about it is that if you do multiple treatments, you can get sizable, right? There's only so much you could do in a treatment. But if you do 2 or 3 treatments, for example, they'll reach the recommended 6.5 to 7.5 inch circumferential increase or girth and so forth. And that's highly desirable.
I mean, there's so much to unpack here, no pun intended. But one of the things that I wanted to talk to you about, how you were able to specialize in this area.
Well, I'll give you a little history.
Yes.
In 1996, I was doing a lot of cosmetic derm procedures like hair transplants and lasers and all these things. In the 90s, fillers started coming out, but they only last 60 days, 90 days. But it was in its infancy. And I knew that at that time that fillers would be the answer to male enhancement. Now, how I even thought of it.
Yeah, how
well,
what was the aha moment?
That's it. I'll tell you exactly. I was getting very busy in my practice, so I wanted to hire a partner. And his name was Tom. And when I hired Tom, I said he was very, very qualified. He was coming from this other medical group that was very experienced. And I said, Tom, well, let's join forces here and team up. But on his CV, he said he worked for urology. Now, he's an internist, so it's kind of odd. So I said, Tom, what were you doing in urology? He said, well, I had a few friends of mine that were doing penis enlargements. I said, really? I said, how do you do that? Okay. He says, oh, we cut skin off the behind and open the penis and stitch it in. And I thought that was the most barbaric thing I ever heard of in my life. So that put this seed, that little splinter in my mind, and I never forgot that. I said, there's got to be a better way.
You were to say, I'm sure.
Yeah.
You started scratching your head.
Oh, scratching a lot. I lost most of my hair because of that scratching. So the point is that I said, well, we got these fillers coming on the market, but they only last 30 to 90 days. That's not efficient, right? So I never forgot that. I said, well, we'll revisit this sometime. So years went by. I moved to Florida and started my practice.
You moved to Florida from where specifically?
From New York. Yeah, from New York. And when I went back into practice, I was doing hair again, like I normally do, and lasers and all that. But then I said, let's look into the filler market, see what's out there, pharmaceutical-wise. And I realized that there were a couple of potential fillers that were long-term. So I said, now we got something. So I was investigating. I have a chemistry background, so we were doing some compounding, and we realized that we've formulated something that could actually work for the guys, And in 2010, I started the practice, and I got so busy that's all I do now. I mean, I couldn't do hair anymore, really. It was difficult, hair and all these other things. So now we can offer something really wonderful for the guys. It's a really good that's a really good procedure and technique. But that's the history.
Let's rewind a little bit. I mean, when you actually realized that there was a solution for a long-term solution, what did your colleagues say to you, knowing that you literally were on the brink of changing the game?
Well, there was some good and bad, right? Of course, some of my colleagues that are non-urology division were excited about it. But now that I'm playing in the urology sandbox, right, sometimes there's some issue. Right? And that happens in every field. If an internist goes into urology or pathology or some other whatever subject or field, there's always pushback, right? And the reason is that, let's say, for example, urologists, very qualified. They do a lot of surgery. They do prostate cancer removal, all wonderful stuff. But they don't lean toward cosmetic on the penile shaft and glands, right? They're not concerned so much about it. They just want to make sure it's functioning
Of course.
and it's disease-free. But what if a man comes into a urology office, and this happens often. They go into the office, they say, "Doctor, I'm pretty small. Can you help me?" He says, "Well, does it work? Do you urinate okay? Does everything feel okay? You could have intercourse okay? Then everything's fine." But not really. So now I enter in. Okay, now I'm doing skin work. It's still dermatology, but it's in that area of urology that I wasn't getting, my colleagues weren't so happy. Now, I'm doing this quite a while, and I'm sure after all this time, they realize that maybe there's some value there.
100%.
So, well, that's what I'm hoping. They don't call me very often. I wish they would. It'd be nice.
You've been doing this for quite some time, and your testimonials and your patients, you're changing people's lives. Let's talk about, obviously we know that there's a stigma attached to really speaking about, the male need the males wanting to have a larger penis. But there comes with a psychological aspect to that. Let's talk about that, because people just think it's physical. And believe it or not, from what I talk to you, it's not. It's more psychological, and there's a lot to it.
If you're a man, we all think the same. I get calls from all over the world. It's the same issue. I don't think I'm big enough. I'm not satisfying my wife, etc. Okay. Now, you could relate it to like a woman getting breast implants, right?
And we talk about that all the time. We talk about all our procedures. We talk about this over lunch, but the fact that it's quite
taboo-ish.
Hush. But that's why we want to do this podcast. We really want to be able to break the stigma. We want to create this very comfortable environment for your patients and everybody to just really have these types of conversations.
That's right. Well, if you go back in time, even with breast implants, because that's a body-altering, procedure. But women that are, let's say, breast size A, that go to a C, they're happy. It's just a size change, right? But still it affects us, right? And the same thing with men. They have men that are smaller, or even regular-sized guys come in, too, because they feel that's still inadequate in the bedroom situation. But over time, let's say when the breast implants came out, it was kind of taboo-ish at the time. Okay, the doctors who invented that got persecuted. Okay, they said, "What are you doing to these women?" Blah blah blah. But obviously, it's mainstream now.
Of course. The first out of the gates, usually in anything, they get persecuted.
Well, that's the same thing here.
Yes.
Okay, but going back, forget me for a second. If you go back and if you look at the history of the male genitalia issues, like erectile dysfunction, for example, you notice when Viagra came on the scene, right? Now it's out in the open. Like, hey, the men could have certain problems down there. So Viagra comes down. These other drugs start coming out. And then it's advertised and it's more accepted to talk about.
Now it's commercially accepted. Now it's part of the dinner table talk.
Well, not yet. We're getting there. But now we move into size. So we talked about functionality, where we have these drugs that help get the erection. But now it's ripe to enter into to bring this information out to the public in more an open fashion, where it shouldn't be tabooish anymore. Okay, it's well known. You ask any man on the planet, okay, would you want to be bigger? Absolutely. Very rare that men would not want to be bigger. And if you interview women, and there was some of these studies done and interviews of many women, and generally what they say as a trend is that they don't like long penises per se, but they prefer thicker penises. Now, why is that? If you look at the anatomy of the vagina, obviously, the clitoral nerves branch into the vaginal space. So if you have a thicker penile shaft, obviously it's going to rub along the walls more, therefore stimulating those nerves and therefore causing greater pleasure. Period. That's just the anatomical nature of it. Okay, and that's what most men lack, is that situation there, the thickness.
And talk to us about the educational process, because I'm sure everybody comes here with different misconceptions and everybody has a different idea as to the end result. What is the educational process when you talk to your patient? Do you make sure they do it for the right reasons? I'm sure it's a delicate situation because everybody has different reasons as to why they're here.
Well, there's not many different reasons, actually.
Okay.
It can all funnel down to one thing, is we just want to be bigger, okay? Because
like two buckets.
Yeah, that's about it. That's right. Okay. So that situation is it's universal, okay, and so forth. But when it comes to education, we have patients call, when they call, we have them talk to our consultants, for example. because they have to understand that we're not only a game in town here. We could do permanent filler, which is what I do,
Yes.
but there's also fat transfer, which I don't do, and other things we don't do. But we want them to be aware that there are other remedies, not necessarily as good, in my opinion, but there's other things out there so they could cut through the confusion. Because one doctor might say, fat's the greatest. Now, fat transfer is good, okay, but it does not compete really with what we do, because when we produce collagen, it's a denser tissue. The penis should be kind of firm when it's erect, not kind of squishy. Okay, one of my patients said his wife calls him a gummy bear.
Oh, gosh.
Okay, but anyway, that's the point.
Of course, we don't. I'm sure you guys don't want to be called a gummy bear.
Exactly. So the point is that we want to provide the best and most efficient procedure possible, and to reach their goals. What are their goals? Well, some want to be longer. Most really want the girth.
Yes.
Okay? The ones that want to be longer are usually under 5 inches in length, so they feel a little, not too good about that. There's insecurities.
Yeah.
Those that are over 5, I tell them that, hey, the length is pretty good. Even though they still in their mind, every man still wants to be longer. Because remember, when people look at porn, this is a bad thing now. They look at porn, they see this long penis, the woman is screaming that she has pleasure. But let me tell you what really happens. I've done porn stars here to get thicker, right? They wanted the treatment done. And I kid around with them. I say, hey, those women like your 10-inch long penis, don't they? They say, oh, absolutely not. They're in pain.
Yeah.
But they're good actors, though. Okay, they're really good actors. So he says what they do is, after they do their work,
Of course, because it's a job.
That's right. They go home to their 6-inch long boyfriends that are thicker. Okay, and that's the fact of the matter. So I have to dispel this length myth. Now, some women do like length. I don't know. Maybe 1 in 500 has to have that 9-inch guy, whatever.
Yeah.
But most don't, obviously.
But I'm really glad that you touched on that, and that's something that we're going to continue to speak about, the fact that, pornography is out there and it's not real. And a lot of the times there's this misconception that it is. So I think it's incredibly important that you ground the plane, right? And we have these types of conversations. And I think it's also going to lend to helping the stigma out and really having these conversations as to males wanting to have this procedure done, but for the right reasons.
Yes, most of them do take it to the grave, that they don't say anything to anybody.
Yeah, and why do you think that is? I mean, obviously we know because it's something very personal, it's embarrassing, but, I really hope that maybe in the future it's not embarrassing, because now with women we talk about our hair extensions, our lashes, our nails.
Lips, cheeks, everything, the behinds, everything.
The works, and hopefully this type of open dialogue will allow for these honest conversations.
I think eventually that'll happen, but we're probably a decade away.
It's okay, and we'll have these conversations. And specifically, tell us about a moving case that you've had with one of your patients.
Moving meaning like something. Well, let me just think about that, because there's a lot of them. I had, I'll tell you kind of a funny one. A patient said to his wife, I'm thinking of getting bigger. I want to maybe have a treatment done to increase my size. She says, oh, no, you're perfect, honey. It's always the perfect, And she said, no, I really do want to go. I mean, I feel I have to do it. I don't feel inadequate. And her voice started getting a little more intense, like, no, you really don't need that, right? And he pushed, and they're starting to yell now, and almost like a fist fight.
Oh, gosh.
She says, look, I'm going. Okay. So he's in my office, obviously, telling me this. I said, okay, I guess I hope you don't get divorced, I told him. Okay. So anyway, he has the treatment done. So I said, John, I know I'm not going to see you ever again, so take care of yourself, blah, blah, blah. Here he is 3 months later in my office.
Divorced?
Well, here's the point. ... Right.
We're all getting our popcorn.
So I said, John, what are you doing here? He says, no, I'm going to have a second treatment. My wife, she woke me up this morning. She says, hey, we can't miss that flight. We got to see Dr. Loria. Why? Because she experienced now that girth, and she understands.
Wow.
Right?
So she's a believer and
That's
a believer.
Right. Oh, she's a believer, all right. Okay. Now she understands, and it was kind of funny getting him up in the morning, made him breakfast early, got him to the airport. You got to see Dr. Loria today. So then she could appreciate it. But the question is, here's the real question. Why was she so against him going? Okay. Now, I think that most women would like, more girth, but they're not going to say to their man, hey, you're kind of skinny. Can you get a little bigger?
Yeah.
We don't say to women, your vagina, can you tighten it up? I mean, we don't talk like that.
Yeah.
Right? Here's the real thing. Yes, she does want a thicker penis to stimulate her, right? But she's more concerned about her husband cheating on her. That was a big issue.
That other layer of the insecurity.
That's right. Now, he is going to be more secure.
Yeah.
Self-esteem through the roof. Is he going to now cheat? And that's what the women think of. I didn't realize that
So
until a few
interesting.
years ago. When one of my patients said, my wife's concerned about this because she thinks I'm going to cheat on her. I said,
That's interesting.
that is very
Well,
interesting.
it's kind of when women say don't date somebody better looking than you.
Okay, here you go.
Right? We have those types of conversations.
That's true, though.
Yeah,
a lot of
because
women
they
think this
say
good-looking
that.
guy is going to cheat
Yeah.
because women are going to go after him, right? That's right. I see a lot of nice-looking women with not so good-looking guys. I said, how is that? You know?
Well, that may be the reason, but that's also that's obviously another topic for
That's right.
another
Yeah,
podcast.
yeah.
But it's very interesting because people do it for the wrong reasons, and people have these underlying misconceptions. Before we wrap, there's so much to talk about, but that's why we're having this series. Why did you want to create a podcast? I mean, you're so involved in your production in your office and with your team. Why did you want to create a podcast to really have this conversation?
Well, this venue allows for discussions of many topics, so it's mainly educational, if you think about it, just to get the word out. I want men not to be afraid of this. I want them to embrace it and learn more about it, because most men want to do it.
Of course.
Not even a question. So this here will give us an opportunity to not only have interviews, let's say with me and you, other doctors and their experices, other patients.
And I know there's some patients that are more than happy to talk to us.
That's right.
Yes,
That's
which
right.
I'm excited
and I
about.
want them to provide a testimonial as well on how it affected their lives. Because this affects literally almost every man on the planet. It really does. So we're going to do this, again, for education, to make it more known among the public, and we shouldn't be so ashamed about it. We might not talk about it, overtly, but at least we could talk about it.
Of course, in a safe space, in a space where you're helping us and you're educating us, and we are really removing the stigma. Thank you so much for chatting with us today. And if somebody wanted to find out more information, where can they go?
The best way is to go to the website. It's loriamedical.com. Right? They can call the office. It's 877 Dr. Loria, DRLORIA. That's a difficult name to spell sometimes. And you just call or email us. You can go through the website to email and so forth. And then we'll connect you with a consultant, one-on-one, private, and get all your questions answered.
Oh, wonderful. Well, I really love that we were able to chop it up, and I can't wait for you to join us one more time next week for Loria Medical Podcast.
Yes, I'm excited about it.
I'm excited too.
Okay.